Hello again, Dr. Anthony Gonzalez here with you for Miami Community Health, and welcome another episode of another important health topic. April, of course, is what many people think is April is Autism Awareness Month, and we're going to be talking about autism, not on this show. But a lot of people don't realize, and I was probably the first one that didn't realize, that April is Testicular Cancer Awareness Month. And I'm sure that every viewer that is watching us and will watch us is obviously has interest in testicular cancer because you're either a man or you have a father, a husband, a significant other, a brother. And so we are going to concentrate today and talk about the testicles and talk about testicular cancer. And I brought with us an expert today, Dr. Danny Martinez, who's here with us. Welcome, Danny.
Thanks. Appreciate it.
All righty. And so we're going to talk about testicular cancer. And Danny, first, just tell us who you are. What do you do? And why are you such an expert in testicular cancer?
So my name is Danny Martinez. I like long walks on the beach, and my favorite color is no, I'm just kidding, man. So I'm a urologist. I do general urology, but I subspecialize in female or male sexual dysfunction, male and female sexual dysfunction, andrology, and infertility. We are the experts of the testicles, and that's why I believe you've invited us here, is because I, as a urologist, deal with testicular cancers in addition to other, of course, malignancies that somebody can develop in these other urologic organs.
All righty. So let's first talk about the testicle. What exactly is the testicle? What is the purpose of it?
So the testicles, these twins, or these organs that live between the legs of a man, they really have two major purposes. Okay, purpose number one is it helps produce testosterone. Testosterone is the main hormone that a man will produce that makes a man a man. It gives us our deep voice, gives us facial hair and hair on our bodies, helps us build muscle. The other part of the testicle, of course, is the fertility site. So it helps us reproduce. The testicles will produce sperm, which, of course, without that, a man won't be able to have a child without their genetic material.
All righty. So, of course, everybody thinks that anything that occurs in the testicle is going to be testicular cancer. It's not the case. So what other things, we're going to get to testicular cancer, what other things can happen in the testicle that a man may see?
Yeah, that's incredibly important. I'm glad you bring it up. The testicles themselves can, like any other organ in a man's body. And as a guy gets older, as we develop other medical problems, it's like a car. The newest you have is the day you're born. Dings, dents, scratches. And so you can develop benign tumors. You can develop fluid around the testicles called a hydrocele. You can develop little cysts of the testicles and even the epididymis, which is the back part of the testicles. You got the testicles right here, and you got a little back part. That also develops some pathology. You can develop calcifications. You can develop also varicoceles, which is a dilation of the veins of the testicles. And of course, you can develop tumors, actual masses. And so it's incredibly important that a man is very aware of this and is always checking themselves. The same way a woman should be checking their breasts, a man should be checking themselves for any sorts of lumps or bumps or changes that they may notice. They may be benign, as you said. There are many other things that we can develop. But if they notice that, they should definitely go and get help with their primary urologist. Have somebody take a look and make sure that it's one of these benign things that don't need to be addressed.
Yeah, and actually one of the things that that I see patients for is for hernias, which a man may feel something down in their testicle and they're not sure whether it's a very large testicle or they have a hernia. And of course, that's where I kind of overlap with what, things that you see. So of course, we've gotten over the benign or the things that are not bad. So let's talk about testicular cancer, which is going to be the focus of our show today. What exactly is testicular cancer?
So testicular cancer is, as the word says, a cancer of the actual testicles. I'll first give you a little bit of some background numbers so people have an idea. So testicular cancer, depending on the year, you're talking about anywhere from 10,000 to 20,000 cases in the U.S. a year. 1 out of every 250 men will develop testicular cancer in their lifetime. It's really considered the most common tumor that we'll see in a specific subset of a specific age range of a man, even though it knows no age range. A baby can develop testicular cancer. An 80-year-old man can develop testicular cancer. There are different types of cancer based off of that age range. But it's the most common cancer that we'll see in men aged 20 to 50 or 20 to 40 something. Okay. So the testicular cancer, as we said, is you have really two types. You have there's two germ cells. It's a germ cell or non-germ cell. The germ cells being the type of cancer that are malignant. These are the ones that can really cause issues and spread and develop into something that can ultimately kill you. The non-germ cell types are usually more benign, which is essentially, there's two types, Leydig and Sertoli cells, and those are the ones that usually don't kill you. Usually treatment is still surgery. And so you get that treated surgically, and that's pretty much it. But the germ cell ones are the ones that we worry about.
And so if a man is checking himself, does he think that he's going to have pain, or what is he going to feel? What is going to make him concerned that he may have something going on?
Great question. One of the more common things that we'll see as urologists in our office is pain in the testicles. And really, it's not pain in the testicles. My guys notice something, and they just want to make sure that they don't have cancer. It's incredible how many guys will walk out of my office after I tell them this isn't cancer, and their pain is immediately better. So cancer is actually usually not painful, which is why it's so important that a guy's checking themselves. Every day when a patient or a person is showering, a man is showering, they should be checking their testicles in order to be able to evaluate for any new lumps, bumps, or masses. The shower is the best because the skin is nice and soft, and so it makes it easier for somebody to be able to palpate down there. Any sorts of changes in the shape, changes in the way that the actual testicles may look, any hard parts, any parts that may be painful or not painful. If something's painful, it's still, the testicles should not hurt. And so if it's painful, you still have to get checked. But the good news is it's usually not related to cancer.
All right. So that's good. So pain obviously is a good sign. So if you have pain, obviously you might not have cancer. But either way, so whether I have a lump, a bump, something new, or a change, or I have pain, what is my first step?
The first step is you need to go see a doctor, whether it be your primary care, or if you're younger, your pediatrician, or you can, if allowed, you go straight to a urologist. The urologists really are the ones that need to see and evaluate you to be able to figure that out. And that's step one. After that, you may need some imaging studies. So it's a lot of times the workhorse to evaluate for testicular tumors is an ultrasound of the testicles. And that's essentially a sonogram. They put a little probe on the scrotum and they take pictures to look to see if there's any abnormalities there.
Okay. And so somebody finds that they have an abnormality there. Usually if they go to their primary, they're going to be referred to you or someone like you to have that evaluated. Then you see that patient. What are the next steps? How does a patient, you see a mass and maybe it's not that guy that you tell them you don't have cancer. You may tell them I'm concerned. How do they make that diagnosis?
So when it comes to testicular cancer, unfortunately, this is not the type of thing that we would biopsy. It's not the type of thing that we can get other imaging studies to determine, yes, this is a malignancy or it isn't. Once we see on ultrasound a solid mass, that person has bought themselves a surgery. And the surgery typically is removal of the entire testicle. Us men, thank goodness we were born with a backup plan. I guess whatever higher being created us knew that testosterone makes us very, unfortunately, do things that are dumb, and we may lose an organ here and there. And so you can live your life perfectly fine with one testicle. But unfortunately, if you have a solid mass on ultrasound and you feel a mass on the exam, that testicle needs to go. And once that goes, that gets sent to a pathologist. The pathologist is really the one that's going to tell us what this is. There are some other studies that we will order. We do blood work because some of these tumors, especially the germ cell tumors, will create these specific hormones in their bodies that we would use, and that's really used to stage the actual cancer. And then we also take pictures of the lungs and the abdomen and pelvis. Why? Because testicular cancer, specific kinds, love to spread. And the way they spread is through the lymphatics. And they go into the abdomen. People say, well, why the abdomen? Why wouldn't it go around the actual pelvis area? Well, because when we're born, the testicles start up here. And then they go down. And so all the drainage from the testicles, that's why they're hanging there. That's why we got a long cord that's connecting. And that cord goes all the way deep inside. And you know that very well, being an expert in hernias. And so the spread is going to be into the abdomen and ultimately into the lungs. That can happen as well. And so that's another part of the workup, is getting pictures as well. So unfortunately, you bought yourself a surgery to get actual pathology tissue diagnosis. You bought yourself some blood work to make sure that there's no hormones that these things are producing, and you bought yourself some other imaging studies. That's essentially the mainstay of the workup for anybody who might have a testicular tumor that looks like an actual cancer.
Wow. Yeah. So it's actually pretty impactful for a young man or any man that he's got a mass and right off the bat, you're going to lose a testicle. Now, is there a way to prevent testicular cancer? Even before that man ends up with surgery, or anybody listening to us, is there a way to prevent it?
Yeah, there are so there really is no way to prevent testicular cancer, meaning, ultimately it's you got to live your healthy life like anything in life. You want to eat healthy, exercise, stay away from drugs, don't smoke, don't drink heavy alcohol. But there's nothing you can do prophylactically. Say, it doesn't matter how many, multivitamins you take, or how much of an herb you think that you consume is going to prevent it from happening. It's going to happen if it's going to happen. And so the most important thing is screening. The most important thing is picking it up early, because even though we just talked about a lot of negative things that people are very now, I'm sure people don't like hearing this and they worry them. The good news is testicular cancer is extremely treatable, but you want to catch it very early. And most guys, they live their lives perfectly fine after getting treatment for their testicular cancer. But the key is not so much prevention. The key is diagnosis and getting it early. So screening and learning how to do your own testicular exams, don't ignore it. If something's off, don't say, I'm going to leave it alone. Go see your urologist. Go see your primary care. That's really the key.
Yeah. So actually, that's what I'm hearing. You can't prevent it, but obviously checking yourself while you're showering, checking the testicles, and make sure that there's nothing there. I always remember a funny story. You tell me that testicular cancer can happen in children, and I had a young man in my office, let's say 16-year-old, 17-year-old boy with a hernia, and I went to examine him, and I noticed he didn't have a testicle. And I asked him, hey, you're missing a testicle? Yeah, no, I've always had one. So I turned to the mother, and the mother had no idea that her son had only one testicle, which brings, to some concern. You as an adult need to check, but, those parents that are listening to us and showering their children and everything else, take them to the pediatrician, or you check them as well to make sure that there are two testicles and there's just nothing happening in there. That's very important.
Absolutely. And actually, that brings up a great point. There's something called cryptorchidism, or an undescended testicle. Mm-hmm. And that is, even though I said you can prevent it, there are certain risk factors, certain men who are prone to developing testicular cancer. That being one. Yeah. If a man is born without a testicle, or an undescended testicle, and that testicle has not been removed, as they get older, you don't even try to bring it down into the scrotum. You get rid of it, because that testicle, unfortunately, is at risk for developing cancer. The testicles are very finicky. Everybody laughs. They say, well, how come when it's hot, they sag, and it's cold, they come up real close to your body? Because they want to be at a specific temperature. Because some of the more sensitive processes that our body will do is actually the testicular function, spermatogenesis, all that. It needs to be in a specific temperature. And plus, not to mention that they're in a place where it's easy for us to screen. Can you imagine if we had our testicles inside our body, such as the ovaries? Ovarian cancer, unfortunately, when it gets picked up, many times it's already advanced, because there's no way for a woman to check their ovaries. And so there are some risk factors, and knowing those sorts of things, being aware of not only my anatomy, but if you have children, your children's anatomy is incredibly important.
Wow. Okay, so testicular cancer, the patient's going to get their testicle removed. That man's going to get his testicle removed. What other treatment is there? Do they need anything in their belly done? Do they need chemotherapy? What is the treatment?
So the initial first step is removal of the actual testicle, okay? And it's done in a very specific way. It's not just a cut. You want to bring it through the inguinal area where you would operate on for a hernia, because you don't want to violate the actual scrotum sac itself. Remember, that's a totally different organ. Nothing drains from the testicles that way. You do that, and you ultimately then do have to do some other treatments, such as radiation, or remove the sac as well. Once you remove the testicle and the spermatic cord from that area, that gets sent off based off of the pathology and based off of the blood work and the imaging studies that are done. That's when then you would determine if you need something else. Do you need chemotherapy? There's a lot of different types of chemotherapy, very well tolerated, very successful, high success rate with treating the cancer. Do you need to have an actual abdominal surgery? Sometimes some men, depending on the cancer, may need a larger abdominal surgery to go in and remove these lymphatics, these lymph nodes that have been infected or have been taken over by the actual cancer. But that you tend to see in more advanced stage cancers and specific types of germ cells that tend to be a little bit more aggressive. So usually most guys, the orchiectomy, which is the fancy word for removal of the testicle and the spermatic cord, or radical orchiectomy, that's usually all they need. And then they just monitor it. And those men, once they've had testicular cancer on one side, unfortunately are at risk for developing testicular cancer on the other side. So they have to be monitored very closely.
Yeah, that's the same thing we see also with breast cancer as well. If you've had breast cancer on one side, more likely. So the usual man will have that testicle removed, and we hope everything else is okay. Now, how does his life change afterwards? Does his life change at all? Does he have to do anything differently besides screening and checking on the other side? Does he need to do anything differently, or can he not do anything?
Yeah, they start walking a little bit lopsided now. No, absolutely not. I mean, the guy will live their life perfectly fine. Like I said, we were born with a backup plan. And most guys won't have issues with what everybody worries about. I won't be able to have children. No, I'll be able to have plenty of children. I won't be able to have intercourse. No, you're perfectly fine. I'm not going to produce testosterone. I'm going to have to be on testosterone replacement therapy. No, most guys live their life perfectly fine. Now, there are certain situations, especially the younger patients, that they want to be careful. And so contact sports, you can still do them, but you have to be very careful because obviously you lose that other testicle and now that's it. Now you don't have any organs that are producing testosterone. You don't have any organs that are going to be able to allow you to have to reproduce and to have a child with your own genetic material.
And then what about the concern? Some men will say, well, what happens if I have only one testicle left and God forbid something happens or I develop? Should they be thinking about banking their sperm?
Yeah, sperm banking is, and actually, I believe February was Sperm Banking Awareness Month.
So I missed that one.
I actually did an Instagram live show for that. So yes, sperm banking is great. Essentially, just for those who don't know what sperm banking is, it's just giving a sample of ejaculate and putting it in a really cold freezer. That's all it is. And you can keep them there for a very long time. There are certain subset of patients that may want a sperm bank. Some guys will do it even with just removal of the testicle. If they're going to have chemotherapy, it's absolutely recommended that they do that. Of course, yes, if they're worried or let's say they have developed a contralateral tumor, so tumor on the other side, yes, sperm banking is definitely recommended. For those men that have had bilateral tumors or a tumor on the other side, you can, and that's one of the few times where we would do what's called testis-sparing surgery. In other words, we bring the testicle up, we try to remove just that tumor and hand it off to the pathologist and see and make sure that those margins are clear of any tumors. Very rare. Unfortunately, when it comes to testicular cancer, specific types of testicular cancer, you don't want to play around with that, but that is an option in very specific situations.
Now, you said you were mentioning sperm banking, and those that have testicular cancer, would be a good idea. Is there another subset of men that should be sperm banking?
Yeah, we recommend any man who's will be undergoing chemotherapy, systemic therapies, to undergo sperm banking. The men that have testicular cancer that may be undergoing the surgery in the abdomen, because that will could potentially affect their ability to ejaculate. In order to have somebody pregnant to be able to ejaculate the ejaculate. And that, unfortunately, is those are where the nerves that innervate that process are found. So that's another subset of patients that may want to bank. As a man gets older, there are men maintain their ability to be able to reproduce, meaning spermatogenesis will continue. Obviously not as fertile as when you were 18, but a man in his 50s, 60s, 70s, 80s can still have a pregnancy. So it's not like women who, as they get older, some of them will freeze their eggs. Men don't necessarily have to do that, but there are some men that will do that. They'll bank some sperm just in case, let's say they have a younger partner or they don't have a partner yet and they're going to be getting married later on. That's definitely an option as well. So those are some other people that would consider banking sperm. Yeah,
well, that's very interesting because I've never really, in my world, sperm banking is not something that we talk about, but I have patients that I operate on for cancer, colon cancers, gastric cancers, other types of cancers, and I've never thought about that, but I imagine the oncologist is telling them that because you're giving them systemic chemotherapy. So that's an important point. God forbid you have another type of cancer, then you should be sperm banking as well. What about prostate cancer? Because prostate cancer is quite common in men.
Absolutely.
Do they need to sperm bank?
Yeah, prostate cancer is actually the most common men other than skin cancer for men, especially above their 50s. Some men will. The issue with prostate cancer, if you're having radiation or surgery, is you're removing the prostate and seminal vesicles. And the ejaculate is essentially a combination of testicular fluid, and that's maybe 10, 15%. About 80% really comes from the prostate and seminal vesicles. So the men who have had prostate surgery, have had it removed, will not ejaculate. So some men will consider sperm banking. Also younger men that maybe have had bladder cancer. I'm a consultant at the Miami Cancer Institute. I do a lot of male fertility there. And that's one of the things I've been pushing for is more of that sperm banking awareness, especially for the deep pelvic surgeries or the retroperitoneal surgeries, sort of in that area where we know that a lot of the machinery that we require, or at least the innervation for the machinery that we require, exists. So yeah, that's something very important that should be brought up on most of these patients.
Wow, very important information. Okay, so the young man or the gentleman has his testicle removed. He has a good outcome. Obviously, he can live his life normally. And we've talked about, and I've heard about some type of implant or something in there because men are be a little bit more sensitive about the fact that they're missing a testicle. So can, just like we do in women in breast cancer, we do put in, expanders, implants, whether it be saline or gel filled or even their own body muscle or fat. Is there a way to replace that testicle in a prosthetic fashion for these men.
Absolutely, yes. The testicle prosthesis is actually created and it's sold by a company called Coloplast. And yes, it's essentially a prosthetic testicle. So you fill it up with saline. There's different sizes. You want to try to make it match the other side so it looks aesthetically equal. And you fill it up, and the testicle itself, it's a surgery. You can do it sometimes at the same time as the surgery for removal of the testicle for the cancer. So you can do it later on. You place a testicle and you suture it in place, and you try to make it look and even the texture the same way. So you fill it with saline so that it has the same texture. And it's a prosthetic procedure that we do that people can opt for if they'd like.
Wow. No, that's incredible. I mean, you said already that, you can live a life without it. So really there's, as long as they're, don't need another surgery, it could be very important. So we've obviously talked about testicular cancer. We've talked about the man who does recover. God forbid there is a more advanced cancer and they have lymph nodes in their abdomen and so forth. Then does that require open surgery? Is that done robotically? How is that operation done nowadays? And what type of outcomes are we talking about with patients?
The formal name for that is called a retroperitoneal lymph node dissection. And nowadays it is being done robotically. It can be done open. Guys tend to do very well. Remember, we're usually talking about a younger subset of patients. And so they have the reserve, they have the ability to be able to not only to survive this cancer or survive this process, but they do pretty well and they recover pretty quickly. But it is a larger surgery, and most guys, you're talking about a surgery where you're a couple days in the hospital and it's 4 to 6 weeks worth of healing. But most guys do very well. Testicular cancer is very well studied. And we have guidelines created by the American Urologic Association that are made by people who are much smarter than I am. And they're very, very good guidelines that we're supposed to follow. And it really goes depending on the tumor, depending on the stage, depending on the blood work, the imaging studies in the beginning, you follow those guidelines, and that's where that will take you. And it's incredible how well, again, testicular cancer, although very common, exceptionally treatable, very survivable. Most guys do very well. Even those that have advanced disease, I've seen guys have shown up and they can't even breathe because their lungs are riddled with cancer, and they just let it go, let it go, let it go. And after their chemotherapy and their surgeries, they look great. They look wonderful.
Wow, that's great. That's good. So there's hope. There's Absolutely. Hope. It's one of those cancers that even though it is advanced, they can. Well, I mean, that's great information. So obviously April, Testicular Cancer Awareness Month. You need to check your testicles. Any other advice you give to our men and obviously the women who have men in their lives with regard to the testicles in general? We learned that there's a lot of benign conditions, but any other advice you'd give them with regard to, as they're now checking their testicles and making sure that there is no testicular cancer, anything else they should be looking for?
Yeah. I always take this opportunity as a opportunity to try to get men to take control of their health. I deal with a very sensitive, very specific area in a man's body, especially when I do the sexual medicine side, the erectile dysfunction, all that. Most men, unfortunately, I know I'm stereotyping here, but we're very bad patients. And the worst type of patient is actually the male doctor. So you and I are the worst type of patients that exist. But as men, we just tend not to be very good patients. And so it's not just about testicular health, it's about overall health, because you want to take control of your overall health. Go see your primary care once a year. Go see your dentist. Get your colonoscopies done. Check for your prostate. You should be getting your prostate exam once a year. Do your testicular self-exams every single day. You do that, and you're going to live a perfectly good life, and you're going to be very happy and healthy. Even though we're born with these backup plans, you never want to be that guy that's in that situation where you have to, unfortunately, you ignored it, and now you're something that could have been taken care of very easily is a much bigger ordeal on you and your family. If you don't do it for yourself, do it for your family.
Yeah, that's, I think, what we've heard over and over here with all my guests is early detection and just healthy. Even I had a guest here talking about depression and anxiety and mental health, and actually just eating healthy and exercising helps your mental health. And of course, this is going to do the same for testicular health. So obviously I want to thank Danny for being here with us today. He touched on a topic that's very important that we're going to talk about, and we're going to bring him back to talk about erectile dysfunction and sexual health as well, especially in the man, and how it relates to their livelihood as well. But remember, April is Testicular Cancer Awareness Month, and definitely check your testicles. Check it daily. Check it in the shower. If you are a female, make sure you have your husband, your father, your brother. Tell them to do the same. And if you feel anything at all, anything different, or there's something concerning, of course, the majority of it will be benign, but obviously seek help with your primary physician. Stay healthy, eat correctly, and of course, check with your urologist. A urologist like Dr. Danny Martinez, who can tell you whether, God forbid, there is something wrong. So, any parting points of advice for our viewers? And once again, thank you for being here.
It's my pleasure. Yeah, my advice to the viewers is happy testicles, happy life. So just make sure that you're checking yourself. It's not an excuse to be grabbing them all the time, but at least once a day when you're in the shower, when you're in the shower, take a peek under the hood. And if you notice anything wrong at all, go get help, because you'll be surprised. Sometimes you'll pick something up that may be very subtle and it's an easy fix. So you want to make sure that you stay on top of these sorts of things.
Well, great. Thank you, Danny. Thank you to our viewers. And once again, Dr. Anthony Gonzalez here, signing off from Miami Community Health.